I was prescribed Ritalin,
clonazepam,
dexamphetamine,
Paxil,
Silert,
Prozac,
Adderall, Elavil.
It's all about money.
The whole myth of the chemical imbalance was created to sell drugs.
You are a guinea pig.
This is not science. This is incredibly effective marketing.
Police department? Yeah. I just killed my 2 daughters.
Sir?
Yeah.
Tell me what happened. Okay, what's going on right now?
I just freaked out and killed them.
Are you on medication?
Yeah.
What kind of meds are you on, sir?
I'm on antidepressants.
I have to say, whenever I read in the newspaper of some violent act, one of the first questions I ask is, was the person on medications?
Virginia Tech or the school shootings or the... my first thought is always, I wonder what drug he was taking.
There's not a single psychiatric drug out there that's going to fix a problem. At best, it's going to cover up symptoms. At worst, it might kill you.
They're not helping people with drugs, and they're not looking out for harming people. They're ignoring the harm that's coming from all of these drugs.
Every day, the average psychotropic drug grosses over $7.7 million. One drug, Zyprexa, rakes in almost $12 million daily.
When you follow the money, you realize that there is no money in health. There's big money in disease.
As a chemist, I'm making these drugs. They're proving deadly in our labs, and they're proving deadly in other labs. Dangerous, ineffective, causing the exact same thing they're supposed to treat.
Lilly, I believe, in February of 2004, did a clinical trial study. The people in this clinical trial did not have symptoms of depression. And in that clinical trial, there were 11 attempted suicides and 4 suicides completed. One of which was Tracy Johnson, 19-year-old college girl. She did not have any symptoms of depression, and yet this drug pushed her to commit suicide by hanging herself.
I'm 10 years old, and I'm going to read, I think, the side effects of a drug called Daytriana.
The drug Adderall. Luvox. Cymbalta.
Gyudon. Lexapro.
Side
effects. Stroke.
What the heck?
Speech disorder.
Eye disorders, vision blurred.
Dry mouth. Nervous.
Tremor. Dizziness. Delirium and coma.
Tardive dyskinesia.
They experience worsening of their depression.
Aggressive reaction.
Paranoid reaction. Psychosis.
Serious cardiovascular events.
Other serious heart problems.
Heart failure.
What?
Suicidal thoughts.
Suicidal thinking and behavior.
Increases the risk of suicide.
An increased risk of death. Sudden death.
These guys must be kidding.
Wow. This is gross.
Seeing this on a warning label, does anybody have any clue what they're putting their kids into?
If you take the drug, there's a chance you may want to kill yourself.
This is a very dangerous industry. You're playing with fire.